All right, guys, welcome back. Dr. Daniel Avery joins us right now to talk about something that affects a lot of people. We're talking about carpal tunnel syndrome. We appreciate you being here. We're actually just talking about some stuff that people do that makes it even worse. But before we even get to all of that, explain to people who may not even understand what carpal tunnel is, what it is.
Sure. And the way it normally starts is someone has numbness and tingling in their hands, and it's not always carpal tunnel syndrome. People have medical problems like diabetes that can cause numbness and tingling. You can have a neck problem that can cause numbness and tingling. But for carpal tunnel syndrome, it's a condition where the nerve or median nerve at the wrist is being pressed. And it comes out of nowhere, doesn't necessarily have to be related to an occupational thing or any injuries beforehand. It's just a ligament becomes thickened over time and starts putting too much pressure. Typically, it gives you numbness and tingling in your thumb, index, middle, and part of your ring finger. Those are classic symptoms. Occasionally, somebody also has some burning discomfort in their hand. Now, the people with burning discomfort, they come and see you pretty quickly because it's very uncomfortable. But the numbness, you know, that can really sneak up on people over time.
And we were saying that there are really typically pretty easy ways, over-the-counter ways, if you will, to treat this. Stuff you can change maybe in the office to make things more comfortable. Can you talk about some of those?
Absolutely. Anyone that I would say starts to have numbness and tingling, they think it's carpal tunnel, their primary care maybe thinks it's carpal tunnel, a wrist brace. You can simply get it at any local pharmacy. It even says on there, carpal tunnel brace. Makes it very easy. Wear them at night only. And we were just talking about the fact, well, why do people get symptoms at night? And it's because people want to kind of curl those wrists in because that's how it's comfortable sleeping.
You go back to your in the womb.
But that puts a tremendous amount of pressure in the carpal tunnel, and it's going to make your symptoms worse. You wake up in the middle of the night, you're shaking out your hands, you're saying, yeah, I had to shake it out for a little while, and then finally the feeling came back and I could go to sleep once again.
So you wear that brace. You mentioned anti-inflammatories, Tylenol, over-the-counter stuff like that.
Aleve, ibuprofen, Motrin, that sort of thing.
And then in the office, standing, those what do you, keyboards with the raised thing on there? I don't know what you call it.
So a lot of people too, what they'll do if they're on a keyboard all day is they'll rest their wrist right where your carpal tunnel is on the edge of a counter or your desk, and it also just puts a lot of pressure on the nerve. Makes it worse.
So those are the easy fixes, but you really should pay attention to the pain, and if it gets to be too bad, don't ignore it. Come see you.
Oh no, yeah, absolutely. I mean, as a hand surgeon, seeing carpal tunnel syndrome in the office can some days be half of my patients.
Really?
I mean, it's super common problem. And we can do a lot of things, even to get some immediate relief if you have that burning discomfort, like with a carpal tunnel injection. But we're going to try the bracing, we're going to try the anti-inflammatories, and we're going to see if it's going to get it under control.
But you said don't wait until...
That's the biggest thing.
That's when you get that nerve damage. That's when things, you can't really do much beyond that.
Somebody comes in and they've dealt with the numbness and tingling for a decade.
Wow.
And they're like, you know, I'm finally ready to get this taken care of. And I have to look at them and I have to say, well, the amount of nerve damage you have is actually severe. So goal one in surgical treatment would be stop the problem from getting worse. And then it's a long process of seeing how much nerve recovery you can get. Where in most cases, if you come in once symptoms are persistent enough, try some conservative treatment. If it doesn't work, go ahead and get it taken care of. And then normal, near normal hand function is a real possibility.
How can people ask more questions? I'm sure they have a whole lot more because this is such a common thing. How can they ask more questions if they have them? Sure.
They're welcome to call the office, come in for an appointment. Most primary care physicians know about this problem very well because they see it first line. You know, and talk to friends, family.
And get a wrist brace.
Absolutely.
Wrist brace. That sounded weird when I said it. We appreciate you, Dr. Avery, so much. Thanks so much and have an awesome